Assure everyone that abortion is still legal in Illinois. Doors are open at 17 Planned Parenthood of Illinois health centers, including our Waukegan Health Center near the Wisconsin border and all across our state. Today, I'm proud to announce a unique partnership between the Illinois and Wisconsin Planned Parenthood affiliates. Abortion providers from Wisconsin now travel to Illinois several days a week to expand access to care at our Waukegan Health Center. We opened the Waukegan Health Center in 2020 in anticipation of this moment. We expected that Wisconsin would cease access to abortion care as soon as Roe fell, so we were prepared to give Wisconsin patients the care they needed. Earlier this year, Wisconsin staff spent several days training in Illinois. Clinicians and medical staff were licensed to practice in Illinois. And we worked out systems so that patients can start and end their care in Wisconsin. We are fortunate to have abortion navigators from both affiliates working closely to help those patients who are forced to travel for essential care overcome legal, financial, and practical barriers to our services. One patient that comes to mind was scheduled for an abortion at PPWI the day after the US Supreme Court overturned Roe. Of course, her appointment was canceled, yet she still needed care very quickly because she has limited time off of work and she's a single parent to young twins. So she had to coordinate childcare on top of travel arrangements. Our new partnership meant that we could care for her days later in Waukegan. Wisconsin provided transportation support with gas money, and Illinois provided financial assistance. So that patient got the care she needed. Sadly, this story is not unique. We've seen a tremendous increase in patients coming from Wisconsin to all Planned Parenthood of Illinois health centers since the Dobbs v. Jehu decision. During this time, we've seen a 10-fold increase in patients from Wisconsin coming to care in Illinois. This is clear evidence that abortion restrictions and bans do not stop people from having abortions. Restrictions and bans only make it harder for people to access essential reproductive health care where they live. We wish Wisconsin patients didn't have to travel for care. Fortunately, trained medical professionals from Wisconsin are providing the care patients need, and Illinois has the space to accommodate the increase in staff and patients. So while Planned Parenthood Wisconsin is temporarily suspending abortion care, Wisconsin patients have access to abortion in Illinois. Now I'm honored to introduce my colleague, Planned Parenthood of Wisconsin CEO, Tanya Atkinson.
Thank you so much, Jennifer, and thank you so much to your entire team for this incredible partnership. We're really, really grateful for all of you. And of course, the Supreme Court's news has been absolutely devastating for the people of Wisconsin because a 173-year-old pre-Roe criminal abortion ban, Planned Parenthood Wisconsin was forced to suspend abortion services immediately after the ruling. And this dangerous abortion ban has had devastating consequences on people in Wisconsin. So forcing people to travel sometimes hundreds of miles for healthcare at great cost, great disruption to their personal lives, or has forced them to remain pregnant. Prior to the fall of Roe, abortion in Wisconsin was already extremely limited and heavily restricted. There were a total of 4 health centers providing abortion located in Milwaukee, Madison, and Sheboygan. So 96% of Wisconsin counties had no abortion provider, and 63% of Wisconsin women live in those counties. Compounding the access problem, many women in Wisconsin face a significant number of laws restricting access to abortion. PPWI was one of 2 abortion providers in the state of Wisconsin, and we provided approximately 5,000 abortions in 2021. Since the Supreme Court's decision, our call volume has doubled, and we're referring all of our abortion patients out of state for care. The majority of these patients are being referred to Illinois. Many of our patients seeking abortion care are already struggling. They're struggling with poverty or trauma or abuse, the devastation of an unexpected pregnancy complication, or simply the complexities of traveling outside of the state for the first time to access essential health care. So this all is a very new and very frightening territory for patients. At Planned Parenthood Wisconsin, we also have anticipated this difficult moment for years and have worked for months and months with our healthcare partners at Planned Parenthood of Illinois and others to do what we can to protect and enhance access to safe, non-judgmental abortion care for patients traveling across state lines. Despite the devastating impact of this criminal abortion ban, we are grateful to have healthcare options for our patients right next door in Illinois. Planned Parenthood Wisconsin is working on many fronts to provide patients with information, support, financial resources, and access to abortion services and to follow-up care. Patients can continue to access appointments for abortion care out of state through our call center and online at our website. And so for people who need added support, as Jennifer mentioned, we have also added patient navigators who can work with patients one-on-one and offer additional travel and financial support. We really want to remove those barriers for people as much as we're able. And at our health centers that previously provided abortion services, we can provide patients with pregnancy assessment and ultrasound dating appointments to find out exactly how far along the pregnancy is. Now, this is especially beneficial for patients who don't know the exact date of their last menstrual period to provide guidance on whether a patient can schedule an in-clinic or medication abortion out of state. And many of our trained medical staff who previously provided abortion care for patients in Wisconsin, as Jennifer said, are now commuting to Illinois to help meet the increased need for abortion care. Their added support and expertise helps to ensure that patients can continue to receive timely access to essential health care during this very, very difficult time. So despite the loss of abortion access in Wisconsin, all of Planned Parenthood Wisconsin's health centers remain open, all 22 across the state, as well as our telehealth work. And access to our services is more important than ever. We're here to empower people with information and access to healthcare, including birth control, cancer screenings, gender affirming care, cancer prevention services, and miscarriage management services. We remain a safe place for people to contact us with any question or with any post-abortion healthcare needs that they may have. Your health and the health of the community is our #1 priority. Planned Parenthood stands for care, and we won't give up. Not now, not ever. And now it's my pleasure to introduce to you Planned Parenthood Wisconsin's Associate Medical Director, Dr. Allison Linton. Dr. Linton?
Thank you, Tanya. My name is Allie Linton. I'm an OBGYN physician, and I'm the Associate Medical Director at the Planned Parenthood of Wisconsin. I, like my other colleagues who incorporate abortion care into our medical practice, do so because we know that abortion is a critical component of full spectrum reproductive health care. The Supreme Court's decision that ends people's freedom to access abortion care in Wisconsin and many other states is both terrifying and heartbreaking for those of us who are deeply committed to providing this work, but especially for our patients. And it's terrifying for them to figure out how to access the healthcare that they need. The decision of whether to have a child or not to have a child is deeply personal, and it should be left up to the person to make that decision for themselves. That is why, in addition to providing OBGYN care in the state of Wisconsin, I am one of the many providers who have decided to commute to Illinois to provide abortion care. The patients I see who have abortions are your friends, your family, your neighbors, and members of our community, and they deserve access to safe, timely medical care. I had the opportunity to provide care for a patient last week who we saw at Planned Parenthood of Illinois before the Dobbs decision came down, who then was able to see us, the same providers in Wisconsin, to provide her care last week, and then will be returning to us to continue her care for contraception and general health care moving forward. The ability to provide this care and to provide that continuity of care was phenomenal, and something that I am so thankful for this partnership for allowing me to do. Planned Parenthood believes that everyone should have the freedom and power to control their own bodies and lives, and as a provider, I am doing all that I can to achieve that vision. I would now like to introduce Kristen Schultz, Chief Strategy and Operations Officer at Planned Parenthood of Illinois.
Thank you, Dr. Linton. I'm Kristen Schultz, Chief Strategy and Operations Officer at Planned Parenthood of Illinois. I'd like to take just a moment and talk about the operational changes that needed to happen in order to make this partnership work. It took a tremendous amount of planning to make this innovative collaboration come to life. As Jennifer said, we had anticipated this possibility for this need years ago, and the Waukegan Health Center opened in 2020. And that's when we started conversations with the Wisconsin affiliate last year about the different possibilities to expand abortion access in Illinois if Roe fell. But the last several months, when it became clear that Wisconsin would lose access, we started putting these plans into motion. We knew that there would be a wealth of trained, specialized medical professionals who would be barred from providing the healthcare that they are licensed to perform in Wisconsin. At the same time, PPIL was anticipating a surge of 20,000 to 30,000 out-of-state abortion patients coming to Illinois for abortion care, and that includes thousands from Wisconsin. And so we reached out to see how many Wisconsin staff would consider working in Illinois, and I thought there would be 4 or maybe 5 who would agree. And instead, the majority of the team in Wisconsin providing abortion care have stepped up to travel to Illinois to serve that patient need. And this includes, as Dr. Linton said, physicians, clinicians, nurses, and support, staff support to make sure that this effort cares for patients. Because of this partnership, we have been able to double our abortion provision at the Waukegan Health Center. And that added staff also allows us to expand abortion and family planning services across the state through telehealth. We launched this partnership just last week, and it already is positively impacting our ability to provide care for patients. There was a recent patient, as Dr. Linton said, who began their care with a medical visit in Wisconsin, where she was able to access an ultrasound and get lab work done. And while she was there, she was able to then schedule her abortion at the Waukegan Health Center just 1 week later. Our navigation program manager on the PPIL side worked with the Wisconsin team to finalize that transportation and funding support so she wouldn't have to face additional barriers to care. And as Jennifer mentioned, patients from Wisconsin traveling to our health centers across the state in Illinois for abortion has increased 10 times versus the pre-June average. And we expect to see this need continue to expand. Luckily, through this incredible partnership, we are able to serve patients seeking abortion care so that they get the support that they need and deserve. And with that, we will now answer questions.
Excellent. Thank you, everyone. Okay, so first question. I feel like everyone sort of spoke to this, but I don't know if somebody wants to make it, restate something, but can you please explain what makes this partnership unique? And what did out-of-state Planned Parenthood collaboration look like before Roe fell? So I don't know, Jennifer, do you want to kick us off with that?
Maybe I'll start, and then my colleague Tanya and definitely Kristen might want to jump in. Of course, we've been collaborating for years, and especially Tanya and I have worked closely together for years, but providers didn't have to get cross-licensed in such high numbers before. And while some providers might have worked for multiple states before, we haven't seen it at this volume, and we haven't been able to really add so much capacity because of the few people who might have been working at multiple affiliates before. So I would say that it's the size and the sort of intensity and the structure of this partnership that's different than what we've always done before.
Yeah, I would agree. We've worked closely with PP Illinois for many years now, and and throughout our histories, and of course, sharing a border, it's not unusual for patients to access care in different places, but to have, to have providers like Jennifer mentioned, specifically licensed in Illinois, to be able to, partner in this very specific, very intentional, very hands-on way. That is definitely a big addition to the partnership that we've already had.
Okay, great. Thank you. Okay, so the next question is, people who live near Illinois have an easier time with travel. And this person is asking, what about those who live far north of Wisconsin? So Tanya, I don't know if you want to answer that one.
Sure. So Wisconsin has got some of the most egregious abortion restrictions in the entire nation, pre-Supreme Court decision. So unfortunately, we've had patients that have, for years and years and years had a lot of barriers, had a lot of transportation barriers, in particular, traveling hours. And so for a very long time, we've provided resources to reduce some of those transportation barriers. And so we expanded that, obviously, because we really are working to return as much agency and decision-making power back to the patient as possible, since it's been taken away from them for their ability to actually access abortion in Wisconsin. And so we provide direct resources as needed if people want to travel to Illinois, or if they want to travel to another state. Perhaps they have relatives or networks in a different state outside of Illinois. So whether people need transportation support for a drive, or for a bus ticket, or a train ticket, whatever it is, really, we work to make that available to them. So transportation is the number one need that we see at this point. And we are, doing everything that we can to reduce that barrier, and are very grateful for the other folks that are supporting that as well.
Great, thank you for that. A question for Jennifer. Do you anticipate other states such as Indiana, Michigan, and Missouri reaching out for similar partnerships?
Yes, unfortunately we do, because the US Supreme Court ignored nearly half a century of settled law and overturned Roe v. Wade. State after state are putting in increasing bans and restrictions all over the country. And so we do anticipate that Planned Parenthood of Illinois will be increasing haven for care all over the Midwest. And we expect that we'll be working with colleagues in many other states.
Great, thank you for that. So now a question for Tanya. Do you think that the OBGYN shortage in Wisconsin will worsen because doctors will have to go to Illinois to perform abortions?
I'm gonna answer it in part, and then I'm gonna ask Dr. Linton to finish this. Well, first of all, I want to thank whoever noted that question or asked that question, because there's a lot of rural parts of Wisconsin, and access to physicians, access to healthcare is challenging, and people have to already travel for hours and hours. I grew up in a very rural part of Wisconsin, and I I've seen firsthand how far people need to travel to access healthcare. And so, I don't know if there's been specific projections yet, and I'd ask Dr. Linton to add to that. Anecdotally, certainly, we've heard from some folks that are less inclined to want to practice in Wisconsin, but that's anecdotally, and Dr. Linton may have more information than I do at this point. It's evolving every single day.
Yeah, I would just echo exactly what Tanya said. I'm not aware of any specific numbers, but it's certainly something that we're concerned about and we'll continue to readdress. Patients need care in both states, and that means that they need reproductive health care from all aspects, and that includes abortion care. So while we are traveling for providing abortion care, we certainly need to still worry about the other aspects of care that we provide in every state in the United States.
Great, thank you. So this is a question for both Wisconsin and Illinois. For Wisconsin primarily. Is there a concern over prosecution for the staff providing the transportation or coordinating services?
That's an excellent question. No, there's not. The statute is pretty clear. It criminalizes providers in Wisconsin, and does not criminalize the person needing an abortion. So the statute is fairly clear, so we are not concerned about that.
And I would just emphasize that all care is being provided in Wisconsin, both the patient and the provider. All care is being provided in Illinois. Both the patients and the providers are physically in Illinois for all care provision.
That's right. And we have had, my answer was succinct, but we've had a lot of legal review because we are not, this puts, obviously the ban puts patients at risk, and the ban puts physicians at risk, and that's not a risk that we at all take lightly. And so while we, while there's a lot of questions that are happening right now about the enforceability of the ban, our primary, in addition to patients, the primary concern is to ensure that our physicians are not putting themselves at risk. So that's a question that we've taken very seriously and have had rigorous review.
Okay, great. Thank you. And now there's a question that's come in. If anyone is coordinating with Dr. Christensen, and I wonder if either, Tanya or Jennifer can speak to there are new facilities being built along the Illinois-Wisconsin border.
Yep, I can speak to that certainly. So the question is referencing a group of individuals in the Dane County area who are looking at, who have bought facilities in Rockford, who have built property in Rockford, and are looking to expand access to abortion care on the border. And we, and we have, had conversations, and what we're seeing is concern across the country about people wanting to ensure that they can be a part of helping access care. And so, so it's a concern, it's a concern that we all share, and people are doing, everything that they can to try to expand access to care. So while we don't have an active partnership, Planned Parenthood Wisconsin is not part of the facility that's happening in Rockford. We certainly know that group and so many others are, concerned about expanding access and making sure that people can get the abortions that they so desperately need.
Great, thank you. We've also had a couple questions come in about Wisconsin staff being licensed in Illinois. I'm making sure, seeing what that process is, and if the clinicians do need to be licensed in Illinois. I wonder if either Tanya or Dr. Linton can speak to that.
Yeah, so all of our licensed clinicians, so physicians and other clinicians, advanced practice nurses, midwives, all clinicians are licensed in Illinois before any care is provided.
Great. And then Dr. Linton, there's another question specifically for you. If there's anything you want to see Illinois lawmakers to do to support providers like you and the patients.
I think that Illinois has done a lot to protect access to abortion. So I think the biggest thing that I would say to Illinois lawmakers who have advocated for patients to have access to this care is thank you. And I would just encourage them to continue to do so in whatever way that they are able to.
Great, thank you. Let's see. Let's see. So a question has come in about providing travel costs for patients and how that works. So I know both Illinois and Wisconsin has navigators. So wondering if both of you can speak to how that collaboration is working.
So Kristen, will you start? I'm sorry, Tanya.
Thank you, Jennifer. Happy to talk about it. And MJ, you teed this up, as you said, both Planned Parenthood of Wisconsin and Planned Parenthood of Illinois have patient navigation teams that support practical needs for patients, and that includes funding for care and also funding for transportation. And so the funding can exist within our affiliates and does. We also at Planned Parenthood of Illinois partner with abortion funds like the Chicago Abortion Fund and the Midwest Access Coalition, who are additional supports for patients that need additional practical or additional funding support. So it takes all of us, but it's coming from both affiliates and outside abortion fund organizations.
I don't have anything to add. I think that sums up really well. On Wisconsin's end, I guess I would just add that people can make appointments directly with our navigators for one-on-one appointments.
Great. And we have a question that came in about the state of access of abortion in Wisconsin. So Tanya or Dr. Linton, I'm not sure if either of you can just give a brief overview of what the state of abortion access is in Wisconsin right now.
Well, there is abortions cannot be provided in the state of Wisconsin except to save the life of the pregnant person. So there are no exceptions for rape. There are no exceptions for incest. There's no exceptions for the health of the pregnant person. So right now, except to save the life of the pregnant person, there is no abortion access in the state of Wisconsin. And Dr. Linton, I don't know if you would add anything to that.
I would not.
Okay, great. So there is another question about explaining a little bit more about this partnership, this agreement, how long it was in the works, and if there are federal funds that are needed to help Illinois handle the influx of patients. So I don't know if Kristen, if you want to step into this one.
Sure, MJ, I'm happy to start, and then I'll hand it over to Jennifer to talk about funding. We have been talking about this at a high level for over a year, knowing that this was likely to be the outcome for Wisconsin. I would say in the last 3 months, the details have come together, really identifying which staff and clinicians and physicians willing and able to come join us in Illinois, and working through all of the operational details to ensure that it would be successful. And at this point, we will continue this partnership as long as patients need it, and as long as staff and clinicians are able to continue to travel to Illinois to provide this care. And in fact, we will continue to expand it in new and different ways as we're able. And with that, Jennifer, do you want to speak to the funding piece?
I do. Thank you, Kristen, very much. And I want to be clear, federal funds do not support abortion care. They haven't for many, many years. And folks might remember that the previous presidential administration promised to defund Planned Parenthood. And what that meant was the elimination of Title X family planning funding for Planned Parenthood patients all over the country. I don't know what's happened in Wisconsin, but I can tell you that Planned Parenthood of Illinois still gets no Title X federal family planning funding. So the federal government is not supporting Planned Parenthood of Illinois in any way, not for family planning services, and certainly not for abortion care.
All right, great. So we're at time. I'm just going to end with one last question that came in, which was, how can volunteers get involved? What can people do in this moment to help out?
Tanya, maybe I'll start and then turn it back to you. The first thing that people can do is support our patients in every possible way. I encourage people to talk about abortion. 1 in 4 women in the United States will have an abortion in their lifetime. Abortion is common and safe. It is a medical procedure that should not suffer from the stigma that it suffers from. It should not be illegal in half the states in our country. So please talk about abortion, support patients that are getting abortions. People can also volunteer at health centers in both Wisconsin and Illinois. People can donate to health centers for care and also for all of the ancillary services that Tanya and Kristen have talked about transportation, about childcare, about all of the support that patients now need because of the barriers that governments are putting into place. So donate, volunteer, and help decrease abortion stigma are the first 3 things that come to my mind. How about you, Tanya?
Well, Jennifer, those are the top 3 things. So thank you for lifting those up. We abortion providers, abortion funds, everybody is working together to ensure access to care, to ensure providers are protected. So so wherever you see yourself in this tapestry, we do encourage you to get engaged. So whether that's a donor, as a donor to a provider, as a donor to one of the funds, the conversations that Jennifer talked about are absolutely essential, because this momentum has to continue to build. This is a marathon now, both in Wisconsin, in Illinois, across the country, in order to restore abortion access to anyone who needs it, no matter what. So there is absolutely a place for you to get engaged, whatever your interests are, whatever your skill sets are. Encourage you to contact either your local Planned Parenthood, your local abortion fund, any other organizations that are working to ensure access. So we have a place for you. You let us know where you'd like to get engaged.
All right. Thank you, everyone, for attending. Everyone who's on this call will get a follow-up email with the press release and the link to this video. Any other follow-up questions, you can reach out to us. Thank you, everyone.
Recording stopped.